Hi. I'm doing an in-service related to the coronavirus that is currently circulating throughout the world, actually. And I just wanted to explain a little bit about this respiratory illness. Was named COVID-19. It is a coronavirus, and we've experienced these coronaviruses in the past. I mean, they're circulating now. It's respiratory season. They call it novel because it's new. They named it COVID because the CO stands for corona, the VI stands for virus, and the D stands for disease. So COVID, and they gave it 19 because it was discovered in 2019. The signs and symptoms of COVID-19 mimic influenza in that it is a fever, generally a cough, and develops into shortness of breath, and sometimes really bad shortness of breath. It seems to be affecting the elderly and compromised people. There is no treatment for COVID-19 at present. We treat the symptoms. So if there's a fever, you could take Tylenol or Motrin or any antipyretic to reduce a fever, and cold and cough medications or breathing treatments, that kind of thing. So they're just treating the symptoms. There's no treatment for the disease. The transmission, they feel at this point, is from respiratory droplets. Much like droplet precautions, you know, when someone coughs, they're coughing, that moisture that they're coughing out has the virus within it. So it also gets on surfaces because that moisture drops in common areas wherever that person coughs. So you know, you could easily touch a surface and then inoculate yourself when you touch your nose, your mouth, your eyes. So that's why the focus, and you might have seen on television or commercials, not to touch your face because you really inoculate yourself. And it's very hard if you're a face toucher not to touch your face. Like even just adjusting your glasses, you know, you really are touching your face. So how do we prevent this? You really need to stay away from ill people. So my husband just had a respiratory virus about a month ago. I put him on kind of precautions within my house. So, you know, you want to, I said you get in the bedroom, you stay in the bedroom. I'll bring you things in kind of until he wasn't coughing or as contagious. Again, no touching your face. Stay at home if you're ill. Cover your cough. Either cough in your elbow or cover your cough with or sneezes in a tissue, and then dispose of that properly, and of course wash your hands after you are either blowing your nose or coughing in a tissue. Disinfection of your environment is very important. Like, you need to really get a good disinfectant, like a Clorox product or a Lysol product, things that have a good kill for different bacteria. And just as a note, at work, the products that we are using here, the Clorox bleach and the Clorox hydrogen peroxide, either wipes or spray, to kill the coronavirus. There is a huge focus on hand washing. So not only would you do it after you blow your nose or cough into a tissue, but you need to be a frequent hand hygiene person. And by hand hygiene, I mean the alcohol hand sanitizer or scrubbing your hands with friction with soap and water for 20 seconds. If you are ill, you should separate yourself from others, like I said. If you think that you have this COVID-19, you need to call your doctor ahead of time and let them know. This is if you supposedly had an exposure, maybe you're around somebody or you traveled and you started to become sick, You have to say, doctor, I was just in France and I now have respiratory symptoms, and they would actually, give you directions so they don't infect people within their office, or they would bring you in and put a mask on you, that kind of thing. And that's when you should wear a mask. Wearing a mask out and about a town is not going to prevent you from getting an illness. You should, however, put a mask on if you are ill and you're going somewhere like to the physician or to an ER. So as you can imagine, because this is new, because people are dying because it's a respiratory illness, because they're labeling it as a pandemic because it's in multiple countries, there is a huge precaution about this. There's not a lot known about it because it's new. So generally when these things happen, they put the highest precautions into place first. So by that I'm saying that they would label it as an airborne disease, that you should treat it in an airborne negative pressure room, that you should have certain PPE on hand to care for this patient. As you know, either facility, either the rehab hospital or John Hines, do not have an airborne room, so we would not accept these patients while there's still not a lot of knowledge about the disease and because we don't have an airborne precautions. So there are a couple of things going on to prevent the disease from coming in. That's the worry. We have to prevent it from coming into the building. So that being said, we have been doing pre-admission screening for travel-related illnesses since Ebola, as directed by the CDC. But when looking at COVID, we did revise those travel questions and symptoms due to that. So every patient, inpatient and outpatient, is screened for 3 different things. We are screening for travel, and if they are outside of the country, we ask what country it is, and when we see that country, we then go onto the CDC system, which tells us what countries are high alerts for what diseases. Currently, the big thing is COVID, but Ebola still exists in the world, and different diseases and different climates. So that information is then called to me, and I'm the one who determines if that is a high risk area. We ask about signs and symptoms to that patient, what respiratory symptoms they have in combination with the travel, and we ask about any exposure to anyone. That was a question, this is a question that was added due to the direction of the CDC. Were you around anyone who had COVID-19? Also new, that is about to begin, is a visitor screening to prevent illness to come in to the facility. So every visitor will be screened at the door for the exact same 3 questions. There will be a log kept. And I just wanted to go through exactly the process of that screening. They will be asked at the door those questions. Have you traveled? Do you have respiratory symptoms? Have you been around anyone with COVID-19? And if they answer yes to any of those questions, they will be turned away and unable to visit. I think that if someone's being turned away, I think that it is within regulation that we do that, but I think that it should be handled with diplomacy, and I think that if the visitor understood that we care for patients, they are compromised, and that we don't want them to get ill, that they would understandably not be, have an issue with being turned away. That being said, if that is true, I would contact the nursing supervisor at first, and they would contact administration if needed, to decelerate the situation. And I don't believe that there'll be a problem, but we want to be prepared in that case. If the visitor passes screening, they are going to get a visitor sticker. We don't need to know their name, but they need to have a sticker. So should a visitor come to another department, say someone shows up in the gym, staff needs to be aware to look for the visitor sticker. And if the visitor sticker is not present, if they got by somehow the front lobby, or in through another door that we were unaware, the staff in that department will have a log and will have to ask the questions, okay? So we just need to make sure that nobody gets by us. We're gonna try our best to screen everybody at the front door, but we need all staff to be aware that any visitor needs a sticker. And if they come every day faithfully to see the wife or the family member or the loved one, they need to be screened every day, just so we have clarity. Also, within this screening, and these are all guidance from the CDC, CMS, and the Pennsylvania Department of Health, all these screenings, every employee must report to me, I'm keeping a log, on any international travel, on any symptoms of respiratory symptoms after travel, or any exposure to a COVID-19 person. So already I started receiving these because we had a department head meeting. So shooting me an email so I could record these things, or calling me if you had questions. Certainly if somebody had respiratory symptoms, they should not be here. But I am available. I'm making myself available for guidance on these 3 issues. You will notice a huge amount of signage change. There will be a sign on the doors related to those 3 questions, and the fact that they cannot visit if they say yes to any of those 3 questions. There will be signage to stop people in the lobby so that visitors can be screened. There will be signs within your departments that say employees should report any travel, respiratory symptoms, or exposure to COVID to me. The best way for us to manage this is to limit the spread, prevent that it gets in, and limit the spread should it get in. That is my biggest concern, because you could stop people from being admitted, and most of the time people have not traveled. We deal a lot with people who have been ill and they've been in the hospital for 2 weeks, so the travel kind of thing is not a big issue. But we've experienced in the past respiratory outbreaks within our facility for illnesses such as influenza, the domestic coronaviruses that we have in our area, RSV. All of these, they label those as influenza-like illnesses because they're very similar in symptoms. So we've experienced outbreaks, and we know how troubling that is. There's a bunch of different strategies we need to stop those, including masking, scrubbing, how that is. So we don't want this to get in. And the way these things usually get into our facility are most of the time visitors, and sometimes staff. So we have to, I'm going to discuss now things that we could limit the spread. So the first thing that I already discussed is that we are currently not admitting COVID-19 patients because there's not a lot known about the disease, and because we don't have airborne precautions. We have to prevent illness from coming into the facility, hence the screenings. That being said, and we are pretty good about this, but we have to become extremely skilled at recognizing the signs and symptoms of a respiratory virus, fever, coughing, sore throat, shortness of breath. And once we recognize these, we have to immediately put people on droplet precautions. We have to follow isolation policies and PPE use. And when I say this, you know, when someone goes into a droplet room, we need to ensure that we have gloves, gown, and mask on to care for that patient, so that we don't, and we have to use PPE properly, so we don't bring the virus outside of the room. I need everybody, and I will send around the policies for transmission-based precautions, but I need everybody and department heads to ensure that their staff follow these isolation guidelines so that we prevent the spread of respiratory viruses within our facility. As I'm saying this, there are, you know, there's a large number of respiratory infections going around our community. You do get my health alerts. We do get the Geisinger newsletter that shows us like what is testing positive in our area. So we know that there's a lot of influenza A, influenza B, RSV, and domestic coronavirus out there. So it's going to be hard to determine if it's COVID. So please follow PPE and isolation precautions. When we suspect someone or diagnose someone of COVID-19 within our facility, we immediately have to make the Department of Health aware. As the current guidelines go, we have to track who came in contact with this person, where they were, who came to visit. So it becomes extremely difficult to manage this, and this is why we're having people sign in, and it's going to help us track that, and this is why the regulations say this. So they would come in and help us do an investigation. I also need to discuss that there are current PPE shortages and outages. So we do not care for airborne people. So we have a limited supply of N95 masks, which are used in airborne precautions. This is why it's so important to prevent the illness from coming in the building and then limit spread if it does. Because you know, we're trying to obtain the correct PPE to care for this respiratory virus. Currently, despite all of our shopping in every avenue we can, we weren't able to obtain more of the correct PPE, so it's also concerning. We are currently working with housekeeping to increase the amount of cleaning of, we call them high-touch areas, like light switches, handrails, things that get elevator buttons, things that get touched constantly and have a lot of transmission of germs. We're trying to increase the cleaning and disinfection of those things. And I do have to say I'm concerned about our employees' health, that I need staff to take care of themselves, eat right, get vaccinations, practice good hand hygiene, practice good precautions, because we don't want you sick, and we want to prevent you from getting ill. And just as a closing to this in-service today, I would like to just review donning and doffing of PPE so that we're clear on what to put on first, what to put on last, what to take off first, what to take off last, and why that is important. So let's quickly go through that and why it's important. I'm gonna stand up. So when you put PPE on, and PPE stands for personal protective equipment, it's called donning. So we're gonna don PPE, so you know the lingo. So always the first thing that goes on is your gown. So within the past maybe 2 years, we switched our protection to these nice white gowns. They're a little bit thicker in gauge, and they're more waterproof, so we don't want body fluids to go through them. They are a nicer gown. They're a little warmer because of the plastic, and they have a nice elastic cuff that is more protection for you. So the first thing you do is you put your arms through, and you make sure that it goes from your wrist all the way up your arms. And the first thing that you're going to close is around the neck. So make sure you tie it behind your neck in a bow is fine. And I want to say to you, you need to tie it. You cannot not tie it, because if it's hanging off your shoulders, you are not protected. This gear is to protect you. I mean, we're really concerned of your safety, so we want you to apply it correctly. And then tie it around your waist. And if you're like a tall man, or you know, a person of larger stature, and you feel uncomfortable, we have the ability to get you a different size gown. These are like a one-size-fits-all thing, and they're pretty big, but you know, we have some 6'4" people. So if you need a bigger gown, just let us know, and we'll get that. We have some available, and we'll get that to you. So, gown on, to the wrist, fully covered. And the next thing that goes on is your mask. So, and these current masks, if you look at them, one side is really light colored, like a white color, and then the other side is light blue. So the light blue goes on the outside, pleats going down, and there is a wire in your nose here, in your nose area. So bend it a little, and I have glasses, so I have to tuck it under my glasses a little bit, and then you have to pinch it around your nose. And then this particular mask doesn't have ties, it goes around ear loops, okay? So once this is secured up here, and this wire is fit to your face, I hope you can hear me well, you need to take the mask, holding it at your nose, and stretch it so those pleats open, and that the mask goes under your chin. Okay? This is the proper way to wear a mask. It's full coverage of your face. This is not the way to wear a mask. This is not the way to wear a mask. I do have magical powers that make masks elevate above the nose when I come in the room. So please, wear it correctly. It's worn this way for a reason, and it's protection. Please wear it correctly. The next thing that we apply are goggles. Goggles are required in COVID-19. We have this type of goggles because we need them to cover eyewear if you're wearing eyewear too. So, and then they are protected. It protects your side too, so there's no splashing. So if you have glasses, just put it over your glasses like this, and put it on the back of your head. And then lastly, your gloves. Now when you put your gloves on, people have a tendency to tuck it under the cuff, but that's not where it goes. The gloves go over the cuff on the outside. So then your wrist's protected. And then there's an order to take it off. It's called doffing, when you take it off. So you try and take it off well, you don't try, you follow the order, and the first thing that goes is your gloves, because they're the dirty part. You touched everything, right? So the first glove comes off, you grab it by the palm, and you pull it down, and I don't have a garbage can, so I'm just gonna drop it on the floor. The second glove, you have to put your finger underneath the cuff of the glove and pull it off so you don't touch anything, and then that goes in the garbage. Okay? Once the gloves come off, if you accidentally touch something, I'm losing my glasses here, you have to immediately hand sanitize if you touch your skin, because you don't want to spread those germs. At any time, anywhere in this process, you contaminate your hands, you have to wash them. Let me just check my notes here. The goggles come off the next time, and when you're taking the goggles off, you should assume that the front of the goggles are contaminated. So always take it by the string and remove them. Now these goggles are reusable, so we just wipe them down with the peroxide wipe. And then the gown comes off next. The gown, I just contaminated myself, so I'm going to wash my hands. The gown comes off from the back of the neck first, and then you can just break these ties. They break easily if you can't get them untied. I can't break or untie, isn't that great? So you want to take the gown off away from you. Take it this way and down the arms, and roll it down in front. And lastly is the mask. It comes from behind the ears and forward and toss. So, and then before I touch my glasses, I need to wash my hands before I touch anything else. You might have to wash your hands between every step if you contaminate yourself, just so you do it correctly. Inpatient at Hines, there's one of, I believe they do it at the rehab hospital too. There's an order of donning and doffing right in on the patient door, so that you could take a quick reference to what you should do first and last. It is contained within the health stream. You could sign on to the health stream, and it is contained, I think, when you're first coming on board. It's discussed PPE, donning and doffing. I just want to thank everybody for their attention, and just tell you that I'm available for questions. I know that this was a generalized education, and I know that there's different specifics within each department, and if that you come across a circumstance that you really don't know how to tackle, that I am available to go through those scenarios with you and make sure that you do things in the proper order to protect yourselves. So feel free to contact me. Thank you.